Chronic venous insufficiency, commonly known as vein disease, is the underlying medical condition that leads to varicose veins and spider veins. Chronic venous insufficiency is a circulatory disorder that is found in almost half of men and more than half of women, but the vast majority of people do not realize they suffer from this disease. This informational video will provide a broad overview of venous insufficiency, what causes it, who develops it, what are the symptoms and signs of this condition, how is it diagnosed and treated, and what kind of doctor should you go see. We hope this information can help guide you on your vein disease journey. Understanding what causes chronic venous insufficiency can help explain why some people are more likely than others to develop this condition, and also explain why spider veins and varicose veins appear. There are two types of blood vessels in the body, arteries and veins. Arteries carry blood away from the heart, bringing oxygen to the cells of the body. Veins carry the used up blood without oxygen back to the heart. The veins in the legs have a particularly difficult job because they have to fight against gravity to bring blood up towards the heart. They do this using the help of something called valves. Valves are one-way doors that are scattered along the length of the vein. Valves open, allowing blood to flow past them towards the heart. Then they slam shut, preventing the blood from falling back down to the feet. The problem is that over time, valves stop working so well. Instead of staying shut, they leak, allowing blood to fall back down towards the feet, a problem known as venous reflux or venous insufficiency. The extra blood remaining in the veins in the legs causes increased pressure in those veins, and they bulge and swell, even causing varicose veins and spider veins to appear below the surface of the skin. Spider veins and varicose veins are the most easily recognizable signs of chronic venous insufficiency. Spider veins are thin red or blue veins that lie just below the surface of the skin. They often appear in clusters, spreading outward like the branches on a tree or the spindly legs on a spider. Varicose veins are larger veins, usually blue or purple in color. Varicose veins may bulge outward or may be tortuous, twisting and turning as they travel. Chronic venous insufficiency causes a number of symptoms. Due to blood remaining in the veins in the legs below broken valves instead of returning efficiently to the heart, your legs might feel heavy at the end of the day. With the sensation of heaviness, chronic venous insufficiency can cause a dull ache and excessive leg fatigue. Cramping is very common, as is a feeling of restlessness due to vein disease. You may notice itching and discomfort above areas of spider veins or varicose veins. You may notice swelling in your feet and ankles. Typically, these symptoms are worse at the end of the day, especially a day spent sitting or standing. Exercise may actually help with symptoms of venous insufficiency, however, because squeezing the calf muscle can help blood flow more efficiently to the heart. Far too often, people don't realize their leg discomfort is due to venous insufficiency. They think that their symptoms and the fact that their legs feel much worse than they did 10 years ago are part of the normal aging process instead of a reversible medical condition. Diagnosing vein disease is simple and non-invasive. A qualified vein doctor can examine your legs and look for signs of venous insufficiency. Then a certified technician can perform an ultrasound, looking for blood flow in the wrong direction and leaky valves within the veins towards the outside of your legs, focusing on the saphenous veins, which again are the most common place for vein disease to occur. After looking at your unique venous anatomy, a vein doctor can decide what is the most likely source of your leg discomfort and which veins are causing you problems. The majority of the time, doctors recommend preventative measures first, encouraging you to lose weight and exercise to promote a healthy circulation. You may also be encouraged to try wearing compression stockings to improve your chronic venous insufficiency. Compression stockings, also known as TED hose, are tightly fitted legwear that promote efficient blood flow towards the heart. A vein doctor can help you choose the correct size of compression stockings and instruct you on proper and effective use. The overall goal of treatment of venous insufficiency is to eliminate unhealthy veins, removing them from the circulation and rerouting blood flow to healthier veins that can carry the blood to the heart in a more efficient manner. In the past, vascular doctors would surgically remove the veins, a procedure known as high ligation and stripping. But vein stripping was invasive and painful, and more than 20% of patients had vein disease return over time. So a number of new technologies evolved to treat vein disease in a minimally invasive manner. These technologies, which include endovenous radiofrequency ablation, endovenous laser ablation, and sclerotherapy, are all methods of sealing shut unhealthy veins under ultrasound guidance, rerouting blood flow to healthier veins. Similar to surgery, the unhealthy vein is eliminated from the circulation, but in the case of minimally invasive technology, the vein remains within the leg until it is eventually reabsorbed by the body. Deciding the best treatment for you should only be done by an experienced vein doctor. These procedures may be performed by vascular surgeons, but only if the vascular surgeon has adequate experience with ultrasound technology. Physicians from a diverse group of fields of medicine, including anesthesiologists, radiologists, cardiologists, internal medicine doctors, and emergency medicine doctors, may be qualified to work as vein doctors. You should feel empowered to ask your vein doctor where he or she trained and how long they've been treating vein disease. Your doctor should be able to clearly explain why he or she has chosen a particular technology or combination of technologies to treat your vein disease. In radiofrequency ablation, a thin device called a radiofrequency catheter is placed inside the vein. Your vein doctor will use ultrasound to make sure the catheter is in the desired location. The area around the vein is injected with numbing medication, and then energy is delivered to the walls of the vein, causing it to seal shut. In sclerotherapy, your vein doctor will inject a medication called a sclerosant into the vein. The sclerosant irritates the walls of the vein, causing them to seal closed. For larger veins, your doctor may rapidly mix the sclerotherapy with air, creating a foam. The newest technology to treat vein disease is Venous or vein glue. The vein is entered at the inner thigh near the knee. A thin device is placed inside the vein, but instead of delivering energy to the walls of the vein, such as with radiofrequency or laser ablation, the Venous device deposits a special medical glue, which seals the vein closed as the device is removed. Venous is over 97% effective at closing unhealthy veins. Some people develop venous insufficiency at an earlier age than others. Genetics plays a huge role. If your mother and father had spider veins, you have a 90% chance of developing vein disease yourself. Because high estrogen levels influence valve dysfunction, women are more likely than men to develop vein disease. Pregnancy can increase the risk of vein disease as well, since estrogen levels are even higher than normal and the amount of circulating blood increases. Weight gain can increase the risk of chronic venous insufficiency. Finally, a job that requires prolonged sitting or standing can cause you to develop chronic venous insufficiency due to the force of gravity acting on your legs all day, every day. So teachers, nurses, factory workers, waiters and waitresses, cooks, truck drivers, and people who work in retail or sit at a desk all day are at high risk of this condition.